Garrett Harper, Facebook Live. You are on. I'm serious. You're on. Hello.
I'm not on yet.
You're on.
No, I'm not.
You're always on. You're on when you come in the morning. You're on when you go home at night.
I'm waiting for this thing to come on.
I don't know. Debbie thinks you're on.
I mean, it's not showing up on my phone, but that's okay. Anyways, welcome everybody. This is Fall Facebook Live. I'm Dr. Garrett Harper.
Robert Graper.
Dr. Robert Graper. And we want to go ahead and just get the 900-pound gorilla chatted about.
You're pregnant?
I'm not pregnant, but we are currently celebrating Christmas here in the office. Now, if you look back and you can see the tree, we have everybody that's kind of represented in our office bringing an ornament. Dr. Graper's represented at the top of the tree, the green guy, the little Grinch guy up there, because he totally is against us having a Christmas
I like to
tree.
make Christmas special, and it's the last 2 weeks, and then it's really special.
So it's special now. We played Christmas music while you were operating today, so you couldn't hear us.
I took a Phenergan suppository just
Fantastic. But in any event, we were playing it. Only about half the patients wanted to vomit when they were listening for it. So we've started and we're excited. Now we're going to have a run of the show tonight that's a little bit different because we are actually introducing our brand new surgeon. So
a new actor, a new character
in the place. Dr. Evan Zug will be with us for the last half of the hour.
And let's be honest, it's eye candy. You got to stick around.
Yeah, I'm not sure he's going to have much to say, but he is a pretty man.
He looks like a cornerback from the University of Alabama.
There you go. Looks like he should be.
And then the Chippendale.
That's exactly right. A combination of the two shouldn't be legal.
And he's smart. I mean, what's wrong with this guy?
I don't know. We'll find something.
You and I think.
Huh. All right. So we're going to go over some questions first, right? And then, like I said, about at the turn of the half hour, we're going to bring Dr. Zug on and
throw out the old guy.
We're not throwing out the old guy. I wanted to have all three of us. We all wanted to be here, but just the way the acoustics of the room set up, it's just not going to.
And I have something better to do, so it works out.
You do. You've got another pickleball game to play, right?
Yes.
Did you win today?
We did win most of the games.
That's fine. So long as you win most of the games, that's still great.
Fire.
Oh, that's awesome. That's awesome. Okay. All right. First question. I'm going to ask you the first question because people read about it. They're going to go to other Instagram and Facebook, and they're going to see people talking about thread lifts. And I feel like we get this question all the time. Threads have been around for forever, right? They've come and gone, and I think there's a good reason for that. But I'd like to get your opinion on thread lifts, who are good candidates, if anybody, or if there's other options people should think about. So thread lifts, and let's for once and for all never have to answer this question again.
What is thread lifts for 100, Bob?
That's exactly right.
Okay. Thread lifts are a simple concept where you pass a barbed suture through the skin and you're trying to hook some of the tissue that is loose in that barbed stitch and pull it in a direction that is a pleasing aesthetic on the face to accentuate the jawline, to eliminate the nasolabial fold, to take out some redundant skin. And it can work briefly.
Right.
But what happens is the suture, because it's a barbed suture, is sharp enough to catch the tissues. It cheese wires through those same tissues, and it lasts, very brief period of time.
Right. And so you're numbing up the skin and the subcutaneous tissues, and then you're passing these barbed threads in the direction that a facelift would pull, right?
Yeah, only if you like the people do you numb it up.
Correct. Only if you, that's exactly right. But I mean, you're not removing any skin with it, right?
No.
So, I mean, you're pulling without removing, which to me would make me think that.
And you're not creating any scar tissue that holds the tissues in that new location. So
right.
Between no scar tissue and so that, if you create scar tissue with surgery, then when you pull it, and even when the stitch is dissolved, the scar tissue holds the tissue in its new, tighter location.
Right.
But with a thread lift, not only does the thread pull through the tissue so it relaxes, there's nothing to hold that tissue in position because there's no scar tissue.
And I also just feel like, you're doing, there's a finite number of these that you pass through. And so these are your anchoring points. And it's like I start to see people and they've got almost, you can see the thread
You
underneath.
can see the skin, and sometimes they feel like they get a chin strap in.
Right.
It's until you think about it, it was a good idea. But when you think about it, it really makes no sense.
It like looks good on paper, but it doesn't work well when you're actually.
It's like the Panthers.
In
They
vivo.
look good on paper, but they don't.
Should be much better on paper, which doesn't come to fruition.
Just doesn't work.
It doesn't work. All right, so that's thread lifts. Please, for the love of God, no more questions about thread lifts. The reason why we don't offer them here
Because they don't work.
because they don't work, right? And so there are non-surgical things that you can do to help tighten your skin, and there's surgical things, and those are very different results. But they're also
And you got a new machine like right now.
we do.
So
And
tell us about
what
that.
a great segue. And so the new machine is made by Reveal. It's called the Denza machine, and it's the first ever machine that emits both monopolar and bipolar radio frequency energy through the skin, no needles, right? So we've got Morpheus 8, which is an RF microneedling system. The microneedling system are thousands of passes of little 30 gauge needles that go through your skin. They emit radio frequency energy to help tighten things. And those little holes also can kind of cause micro injuries that create collagen and elastin fibers.
Sound science.
Yep. It's not the most comfortable thing in the world, right? You're going to want to be numbed for this.
No pain, no gain.
No pain, no gain. So we have patients that we take back to the operating room for this and just kind of do a light sedation, like if you were doing a colonoscopy or something like that, right?
We're not doing the colonoscopy.
We're not doing the colonoscopy here, but we're working with some people in the community to try to get all that done at the same time. And then, but the Denza machine has absolutely no needles to it. So this is a painless, and we did this last week. I mean, we were one of the first offices in the country to get it. It just landed in the United States. It's got, great papers. It's got great histological, meaning when you take specimen samples, when you do skin biopsies and you look at it and you stain for elastin and collagen, they're seeing huge amounts of increase in patients after having one treatment. Morpheus is a series of 3 treatments. It's, probably better in patients that have stretch marks or that have scars, because those little micro needles can break that up and really help that damaged skin. For patients who aren't surgical candidates but want a skin tighten really anywhere on their body, this Denza machine is done, great, right?
So somebody who's not a surgical candidate is somebody who has medical issues that don't allow them to go to sleep.
Right.
Somebody who is young and looks good, but doesn't look quite what they want to look, and they're too early for surgery. So they need an ideally a non-surgical option.
Or it's a
This is
quality issue, right? Like these machines help with quality. Surgery is quantity. You did a facelift today. You removed skin.
Yeah.
And it was the removal of that skin and the patient's preparatory work in getting their skin to a better quality that's going to get them the best result, right? Great quality, proper quantity, all those things. So that's who a non-surgical candidate is for this.
Now, are we offering any kind of early adopter cost?
Yeah,
for these?
absolutely. So, the prices now for these machines will be different. For this device will be different in 6 months. It just will.
So as we're learning, patients can take advantage of us learning.
Absolutely.
And that's a cool thing. I think.
Absolutely. And the other cool thing is that it's one and done, and it's immediate results by the emission of the bipolar energy that's more at the surface level and the top layer of our dermis, which is our second layer of skin. You see immediate results like off the table. Now,
Really?
Yeah, and the monopolar energy goes deeper into the reticular dermis, and you're seeing up to 80-90% increase in collagen and elastin fibers in these patients, and it's only getting better with time.
So I'm not going to be doing
that
any new
stimulate.
facelifts. We're going to just do this on everybody.
So if we start doing this on young enough patients and they come in and take care of their skin, it's definitely going to minimize. I think you and I will be retired by the time the world catches on to starting to do things in their 20s and 30s. But who knows? Much younger patients are coming in for Botox and filler now, right?
Sure.
And so if you take care of your skin, there are some things,
What's recovery? I'm sorry to interrupt you, but I know people want to know this new technique. Is this I'm at work the next day?
0. I mean, in 24 hours, you can get back in the gym. You want to stay hydrated the whole time, but you can use your cleansing system that night. You can start to do some
You're at
put your makeup
you're
on
at
the next day.
an event that weekend.
Yeah, this is non-ablative. Like you're not seeing, it's not resurfacing
They're
like
not
some
even
of the lasers.
swollen.
No, maybe that first day you are, but like really 24 hours, you're doing awesome.
So if they did it on Monday, Tuesday, Wednesday, a social event, Friday, Saturday, Sunday, no problem.
Perfectly fine.
Ooh,
Perfectly
that's
fine.
big.
Now we've got a graphic that we can show patients where the treatment areas are, but really, it's like any of these machines, just like Morpheus, skin is skin. Now it requires different energy to be delivered and different sized tips for the hand piece, because obviously you can't use a larger, body
Yeah.
tip under your eyes, but like skin is skin. It's going to respond the same. It's made up of the same things.
The knees,
Everywhere.
underarms,
Everywhere.
different tip, but same tightening.
So different tip, same tightening, and then you dial it different, right? Because the dermis, the skin thickness is different under your eyes than it is on your back, right? It just is. And so you want to be able to deliver that energy. So you dial up the machine.
And a little looseness after a baby on the tummy, that's not enough for a tummy tuck, but
Absolutely. Especially,
Really?
if you've got the stretch marks, I think we're leaning towards the Morpheus right now because that kind of helps with the stretch marks. But if they're faint, or if you just say, I just have lost some of the firmness to my skin, this thing works wonders, right? And so
It's
we're
pretty exciting
really
technology.
excited about it. You got to shave your beard if you're a man, but more men need to do this. All the women are so beautiful, and all the men just kind of like start taking care of yourself.
Speak for yourself.
Not everybody's beautiful like you, right?
Yeah.
I mean, we've got to take care of ourselves. All right, so looking through some of these things. All right, question about using post-op Lovenox. Is it indicated for every patient? No, right? So as far as what they're talking about is thinning your blood after surgery to prevent blood clots. So
For at-risk patients.
For at-risk patients. So if you're at risk, meaning we can give you a score, which has been used in plastic surgery
Cipriani.
for decades, right?
Check that box.
Check that box. And so that tells you kind of what we need to do. But, if you're doing surgery here, you've got Ted Hose stockings on, anti-embolism stockings. You've
During
got
surgery, you got
leg
compression boots.
squeezers that start before we induce your anesthesia. We want you hydrated. We want you up walking, all those things. But in a small percentage of patients, sure, we're going to put you on probably not Lovenox, the injections. We're kind of doing Eliquis and Xarelto now, and they're having just as
I'll
good
bet you
results.
probably, with all those tummy tucks and the body lifts you do, you probably use it way more now. Doing facelifts, eyes, noses, forehead, stuff like that. I really don't use it.
So I feel
because they're
like
up walking, but your bigger tummy.
So I
things-
do bigger cases, but I would also say that the first 10 years of your practice, you're very kind of responsive to what happens, right? So if you have a patient that you put on a blood thinner and they bleed and get a hematoma, you're like, I'm not putting anybody on anything. And conversely, if you have somebody that develops a blood clot after surgery, the knee-jerk reactions, everybody's going on it. So I think we've been established enough that we know not to have those knee-jerk responses.
The at-risk patient gets it. Everybody else,
100%.
we're going to do hose,
100%.
hydration, early ambulation.
Absolutely. And I think the graphic probably told people, but Morpheus, Denza, these skincare treatments, face, body, everywhere. We are going to change.
Toes?
I haven't seen toes yet.
You don't want loose toes. You want tight toes.
I mean, most toes are tight.
Earlobes?
I would imagine. Earlobes, haven't seen it. Don't think they have an earlobe tip just yet. But if you want smaller earlobes, you're a great man to reduce them. You know what I mean? Said that's what you want.
And Dr. Zug, I don't know if I should say this or not, but the labiaplasties he's been doing.
That's right.
We don't want to put him out of business because this thing, I have no idea if it works on that or not.
Yeah, I would.
Let's leave that alone for a while.
Probably leave that alone until we have some studies on that. We're not going to personally do the study.
No,
here.
we're not.
All right. Will Morpheus work on my C-section scar? Of course it will. 100% it's going to improve your scar. Like I said, it's going to break up the scar tissue. It's going to form increased collagen. It's going to increase the vascularity to the area and will really improve scars, which is great. This patient wants head to toe. I love it. I would agree with that. All right, next question. Does a facelift include the neck?
Facelifts include the neck. Neck lifts don't include the face.
Okay, so how's that?
And this is just our office terminology.
Right.
Other offices could have
Good.
different terminology. But for us, a facelift is sort of cheekbones on down.
Yep.
Neck lift is jawline on down. And then if you're just doing the face because your neck is good, which is an unusual situation, but occasionally happens, we
Sure.
call that a mini facelift. Different offices call all that thing different names.
Yep.
It doesn't have anything to do with the eyes. It doesn't have anything to do with the brows. It doesn't have anything to do with the nose. It's a quantity treatment, not a quality treatment, which would be chemical peels, laser resurfacing, that kind of thing.
Okay, so to wrap, so if you come in and Bob Graper says you're a great candidate for the facelift, their neck's going to look a whole heck of a lot better.
Oh yeah, it's all part of it.
Awesome. Okay, will my brows be lifted with an eye lift?
No.
Okay.
Well, the way I think of it, eye lift is the eye or aesthetic unit of the orbit.
Okay.
That's the upper lids, the lower lids. The brow is part of that aesthetic unit, but a brow lift lifts the brows.
Yep.
It may take the grooves that we treat with Botox all the time, and it may make the upper eyelid look better, but it's not an eye lift. An eye lift would be just taking skin, fat, muscle from the upper eyelid alone.
So if you think of the eyebrow, right? Like here's our hairy eyebrow. The eyelid surgeries are below that, right? So you do look at brow position when you're evaluating
Absolutely.
a patient to see how to get the best kind of cosmetic, youthful appearance, because you don't want a low brow on somebody and then all of a sudden, you're removing skin and
you're making a diagnosis.
Yeah, that's exactly right.
So is the brow the problem that's
Right.
causing the skin in the eyelid, or is it just extra skin? And it's not that you grew skin; it's the skin you had stretches, kind of like your tummy with babies, or
Yeah.
Just getting older stuff stretches, unfortunately.
So, and one of the cool things, just to segue into that as well, is that there are patients that have some laxity to their eyelid skin and aren't surgical candidates. And for those patients, that's where this Denza machine, this, non-invasive, new monopolar, bipolar, they've got a small little square tip that I had my lower eyes done last week. And the eyes are funny because it's the thinnest skin, take the longest to see the result. You get a little bit of the on table, not as much as you do for the neck or the submental areas and other places, but you will get that, regenerative quality afterwards of your collagen and elastin in the next kind of 6 weeks to 8 weeks. But, you can treat upper and lower eyes. It takes 15 minutes per eye. So in 30 minutes, you can get a major treatment. It's not like if you're not surgical, it doesn't mean do nothing, but it means a combination of, eating right, good hydration. We've got the world's best skincare products. We've tried everything. Our estheticians have 100 years of experience. Literally, that's not like trying to make them
absolutely true.
They're incredible. They are the best in the business, and they're going to tailor your skincare treatment. Currently the Revision products are really great for periorbital. The DEJ eye cream has been a staple, and they now have a new one that's this kind of vitamin C serum that's made more for the lower eyes. But the combination of these non-operative procedures that really, getting in there with the needles for the Morpheus is a little, you can really get in there up to your lash line with this Denza and see some really great improvement in the quality of your eyelid skin. No pain. None. I actually had to tell the lady.
When can I make my appointment?
We can do yours tomorrow. If you come in, you don't come in on Thursdays though.
Or Friday.
But you'll come in tomorrow. Spend the night with me, pickleball in the morning, and we'll treat your whole body.
Done.
All right, perfect. All right, now a couple of things to announce tonight. For attending tonight, meaning like you logged in and we have record of that, you can schedule a complimentary consultation with either myself, Dr. Graper, or Dr. Zug, who you'll meet in 10 minutes. Just call the office, give them the code FALLBEAUTY23, not hard. You can also just say, I watch Facebook Live, and they'll know what you mean. But isn't it fun to have a code, right? So we will also be selecting 2 names from tonight's participants. 2, 'tis the season. We want to gift give. And so somebody's going to win $350 worth of Botox, and another person's going to win $250 from Revision Skincare, which is pretty awesome. So be on the lookout for that. We'll let people know. I think tomorrow is when we let people know who won. Okay. More questions?
Is there a question about Dr. Zug in high school?
No, there's not. There's no questions about that. You're not going to embarrass him the first time we bring him out. I'm going to do that. All right. How should I know what implant size to get? I'm going to take this one.
We're talking breast implant?
Breast implant, I assume. The good thing is you don't have to know. And that's what's so wonderful about this. And I also don't want patients, it's inevitable. You've looked at websites, you've read below, you've seen this patient has the 450 high profile and I want the 450 high profile. That's not how we work, right? Because, we're going to do a series of measurements on you, and we're going to use those measurements to offer you a breast augmentation that's safe, that's going to last for a long time, and that doesn't make you look like wildly absurd, right? Some patients come in here, caricatures. It's just not, ultimately our name goes out there with every surgery that we perform. So as much as patients may be interviewing us, we're also interviewing you. We want this to be a good fit. We want you to believe in our work, but also our philosophy on things. And the number one thing is safety for everybody. Obviously, we talk about that all the time. But what we want you to do is know what look you're after for your breast, right? So don't worry about what implant. Worry about how to communicate to us what you want to look like. The best way for me, we're visual learners. We've gone into plastic surgery. You telling me I want to be a C cup does nothing for me because
I did a C cup.
Oh man, you go to 5 different bra shops, you're going to get 5 different measurements. So we want to look. So bring with you 2 to 3 pictures of somebody in a bikini. A black turtleneck's not going to help us.
Or just if you can go on all the many websites that are clinical that they just have breasts in their post-op pictures or pre-op pictures you just like are pretty. You like the bikini. I think the bikini can kind of distort things a little bit.
I think it can. I mean, obviously.
Certainly this picture doesn't help.
It doesn't. I think my point to some people is, we have a lot of modest patients and it's already can be an awkward scenario. We try to be as relatable as we can, but ultimately, women are trusting us and they're coming to meet us and they're having to be examined by us. And I want them to know that they don't need to go scour the internet looking for nudie pics. That if they've seen Jennifer Aniston,
thing,
right, absolutely. And so if they know that they love Jennifer Aniston in her bikini and just go with it, that movie, awesome. Then send me a couple pics of that. Or, most people are on social media, especially if they're following us on Facebook. So they follow people on Instagram. They do all these things. So there's somebody that they know that, wow, I love the way she looks in her workout outfit or in her bikini. And if you provide that to us, we will help navigate you to choosing the right implant size. So we don't expect you to know anything about implants. It's great to educate yourself. We'd love to educate you too. We want you going back to the operating room with as much knowledge as possible. But the best part of it is you don't have to come in here and know exactly what implant you need. Okay. A couple of questions, which is great, about Aveli. And I'm going to let Dr. Zug talk about that when he comes out. But right now, I have a great one for you. Dr. Graper, are you performing upper and lower blephs?
Yeah.
All day, every day.
Yeah.
Yeah, it does a ton of them. All of us do every surgery here. There's no doubt that Dr. Graper does the majority of the surgeries of the face and eyes. He just loves those cases and is really good at them, so you should do them. But eyelid surgeries, we do all the time. I love eyelid surgery. I'm sure Evan does too. It's a beautiful surgery. It's nice sometimes to sit down and do surgery. That's always a positive. We're constantly on our feet and all that, especially with all the body work that I do. So it's nice to sit down.
You
and do
never
case.
sit down when you're doing body stuff.
Ever. Unfortunately, never. Okay. Had a full face in 2005, 18 years ago. Things are sagging. 18 years from her original surgery. Would a mini lift help with the jawline? Needs her eyes done again. Also being done in 2005. So talk about the patient who had surgery 18 years ago and maybe doesn't look exactly like they did post-op from surgery, which is entirely normal and expected. So are there options for those patients?
Oh, sure.
Okay.
I mean, an examination and what do you want to achieve? The non-operative things you can try, the surgical things you can try, we can guide you through.
Right.
And really, we always go back to what is the diagnosis? You have an idea of what you want to fix, which is very important. And then we take that and look at what is actually wrong or can be improved.
Right.
And then what is the procedure that does that?
And not just the area of the face, right? Like we talked about, you may need to fix somebody's brows to get their eyes to look better. And somebody just comes in and thinks they've got a bunch of excess skin on their eyes, and that's not their problem. And that's where, 50 years of plastic surgery in the group is what's going to help these patients. But also knowing very simply quality and quantity. We take care of quantity, right, with surgery, and these non-surgical devices help with quality. Can help with quantity a little bit if it causes shrinking, but if you're somebody that's got just a lot of excess neck skin, jawline, you are just throwing money away, and we won't offer it. And I mean, that's a pledge that we've made, that Dr. Draper's done for 20 years here, and that I've adopted over the last 8, and Evan will adopt going forward. We're just not going to offer you something that isn't going to work. I mean, ultimately, we want all of our patients to be ecstatically happy. I would love to say every single one of them is. That's not reality, but I think we do a really dang good job, All right. Other questions. This is happy birthday to Nicole Warren on Friday. That's fantastic. Okay. Should you do cool sculpting before the cellulite treatment? So,
that's Zug. That's got Zug all over.
So I kind of threw that out there because he's listening, so he can start ruminating on that and thinking about what his answer is going to be. But that will be a good one. Okay. Another Avelli question, which will be great. And then, how much do Avelli treatments cost? He'll talk about that. All right. Okay. What'd you do today?
I did surgically. I did a facelift.
Okay.
And then I did a breast aug with a little kind of a mini lift, what we call a periareolar lift. And I played pickleball.
So I get asked all the time, not to put you on the spot, I get asked all the time, Dr. Graper still working, Dr. Graper? And I'm like, the guy's busier than he's ever been. So just because the guy's getting good at pickleball doesn't mean that he's not here. Which, did you dinkle or did you dankle tonight? You stayed out of the kitchen.
I stayed out of the kitchen. I dinked when it was appropriate.
And you
I drove the ball when
it
was appropriate.
Good. All right. Because when my brother-in-law comes up, right, he is the 2-time champion at Ansley Country Club in Atlanta of men's doubles. And so he's going to want to play pickleball.
Well, I'm going to need strokes.
I love that. All right. I don't even know what that means because I've never played pickleball. I don't dinkle and I don't dankle. I go home and do
we'll play for money.
I go home and do yard work. No, you got to give me strokes then, right?
Yeah.
All right, good. All right. More questions, and then we will get Dr. Zhu again. Okay, great. Ready? I like this question. I'm going to take this one. Is PRP a good alternative to finasteride for male pattern baldness, or not much evidence on it? There's great evidence on it. Okay, PRP for hair restoration is becoming a huge staple. This is what people used to do. They used to take finasteride as a pill, And then there are all sorts of side effects from it, right? And just not something that you needed systemically in your body. You wanted it to deal with the cells for your hair. So what we've done here is very, very different. You don't just go on Rogaine. You don't just take, finasteride to, and there's another one besides finasteride.
Minoxidil?
No, that's a combination of this. It's dutasteride, I think. It starts with a D. It's one of those. But there's a couple of formulas that we use for all our patients that get PRP injections. Stacy Venator, who's not here this week because she actually spent the last 2 years not only working here, but going back to school. We couldn't be more proud of her. Got another nursing degree just to kind of amp her up, which is amazing. And she graduates tomorrow is her ceremony, and she'll be back next week. Way to go, Stacy. But she's our PRP queen. She does PRP to the face. PRP to the hair is really kind of the bulk of what she does. And along with that, we're having patients do a topical compound that we will get them set up with. And I actually bought little bottles, little spray bottles that I'll put the solution in. And then every night when I get out of the shower, I will spray my male pattern baldness areas. I do.
You got a full head of hair.
I looked like you 3 months ago.
Oh, yeah,
Yeah, don't you remember?
No.
Yes, that's why I wore my cap and everything.
No.
Yes, I did. So PRP is a mainstay. It's fantastic. I don't think it's as good by itself as doing it in conjunction with topical finasteride, which greatly reduces any of the side effects that you could have had from that. And I mean, there were libido side effects. There was sex drive side effects. There were things that you don't want to get in the way. You're not trying to get a full head of hair and not want to, jump on your wife, right? You don't want that. So that's what you can't do.
Is why
Debbie's telling me stop talking about this kind of stuff, apparently, is what she's trying to tell me, right? All right. So
I get to introduce you.
You get to, but I just want the audience to know in no way is this emblematic of like a changing of the guard.
Of course it is.
Just because you're getting up, call him, get on his schedule. My hands are getting tired. This guy, we got to keep him crazy busy because he's got to keep coming Monday, Tuesday, Wednesday. I want him so busy they has to come back on Thursday. Maybe even Saturday.
This is a great practice. You have made this practice better. You are now running this practice, which I'm thrilled about because then I don't have to do it. You're doing a great job. And Dr. Harper's brought in Evan Zug, who is a Charlotte native.
We've brought in Evan Zug, not just me.
Okay, we brought in
Evan
Zug, Charlotte native, did medical school at University of North Carolina, go Tar Heels, and then we got him after 3 years of plastic surgery training in Alabama. And I'm just
sounds oxymoronical, doesn't it?
I'm going to be a little sexist and say the guy's got some eye candy on his side.
Yeah, he's better looking than us.
So Evan, come take
there we
the
go.
seat.
All right, coming in.
So good to have you here.
Glad to be here.
Right? I love that. I love that.
Is this an upgrade or what?
I mean, I've seen pictures of you when you were our age, though.
Oh, I was way better than all of you when I was your age, but that was a while ago.
And I know for a fact that your wife was the best looking woman on Chapel Hill campus.
Oh yeah,
because my next door neighbors tell me about it. So you're a lucky man.
I know that.
He
was a beta.
Y'all
sit down, do your thing. Been a pleasure.
All right. So Evan,
knock him dead, man.
Evan's here. We're going to introduce Evan for a second. We're gonna learn a little bit about Evan. Evan, say hello.
Hello.
All right. And we're going to try to bring Evan a little bit out of his shell. He has not been thrown in front of a camera before, so he's going to do great. But I'm going to try and not embarrass him too much. Okay. All right. So let's go over not to just put you right into the midst of the fire, but I'm just getting a ton of questions about Aveli. And so Aveli is the cellulite treatment. I don't know if you can see it back here, but Aveli is a cellulite treatment. There have been many, right? Like Zoe came out, was that injectable that people were trying. And so tell us, kind of show us how Aveli works. I know you've done it on a couple of patients, and we just started doing this in the last month. Patients are coming back. You showed me the before and afters today. They look fantastic. Tell us a little bit about what cellulite is, how this corrects it. And when people think there's cellulite versus maybe some skin laxity, what's a good combination for them to try and get, somebody asked about cool sculpting before this. Most cellulites on the thigh, the legs, and the buttocks. And I've never heard of anybody getting cool sculpted there. So I would go ahead and say, you don't need to do that. I would say that, cellulite is not something that just happens in overweight patients, right? Like cellulite happens in everybody. It's genetic.
Most women have it.
That's exactly right.
And, there's been a lot of things that have come out that people have tried and have not worked. And this is the first thing that I've seen.
Right.
I have some buddies around the country in Dallas and other places that have been using it longer than us, and they are really excited about it.
I like that. I remember, coming into the office and you were on the phone talking to these people and really getting, because that's an important aspect of plastic surgery, right? Like is hearing from other people and learning from them and learning from mistakes too, right? If some people called us and asked us about a couple of devices that we've tried here, we tell them heck no. So it's great to get, once you get somebody that you trust that gives you that kind of nod of, yeah, this thing works, my patients are happy, it's great. So this is the handpiece.
Yep.
So it's a
disposable handpiece, and it's,
so each patient gets their own.
Each patient gets their own.
And it's done. Okay.
I don't know if we want to show that video or if we want to show it in a minute. Y'all just let me know when. But cellulite is these little fascial attachments that are between the skin and the superficial fascia of the buttock and the lateral thigh and posterior thigh. And it doesn't matter if you've gained weight or lost weight, it stays there. It's part of your anatomy.
Sure.
And this device goes in and manually divides those attachments.
So does the patient have to get completely knocked out for this?
So no, the patient that I did last week, she was wide awake.
Okay.
We numbed up her butt, and
so you just inject it, right?
Yep.
Inject it with numbing medicine. Give it some time to take effect.
Even putting in the numbing medicine doesn't hurt.
Yeah.
So her whole butt was numb, and we had marked her before surgery.
Right.
All the areas that she wanted to be treated.
Yep.
And then we went in and divided all those areas with this.
So small little nick incisions, not
small little incision in the gluteal crease, like you would do for liposuction, like 0.5 centimeter.
Okay. And then you just tunnel that device underneath the skin where these bands are.
Yep. And there's a little light on here.
Okay. So you can follow that through the skin.
Exactly.
Like ET.
Yeah.
Oh no.
It's actually pretty easy to do.
It's awesome. That's great.
It's very easy to do.
Yeah. Awesome.
And it's the first thing that I've seen that actually works.
Yeah. So I've seen that. So at the edge of it, you've got these little buttons on there, and it almost deploys this little like sickle, like looking hook. And then you feel that band and you can see the skin go. And then once you come through it, it just completely releases, right?
Yeah.
Now, a lot of patients mistakenly think that they have cellulite, but they've got loose skin, right?
Right.
As we know, gravity always wins. It's a great line from a Radiohead song, Fake Plastic Trees, gravity always wins.
Great song.
Great song. And so if a patient has cellulite, right? Like if you pull up on their skin and it goes away, it's skin laxity.
Right.
If it doesn't, and then you can see people when they clench, sometimes if they have some gluteal clenches and really kind of brings their buttocks in, you can see them as well. And you mark those, but you can combine this with, say, Morpheus or the Denza machine that can help skin, right?
Yeah.
And treat both of the things that are probably contributing to that patient not loving their rear end, right?
Yeah, exactly.
Or their thighs.
It's, you need to come see us, and because it has to be in the right patient.
Right. Patient selection's key.
Yeah.
Yeah.
So, it's not going to work if you're not the right patient.
Right.
But definitely combining it with Denza or Morpheus, that's going to help tighten the skin.
Okay.
As well.
And one of the things that, people always talk about, how much does it cost? How much does it cost? The device is not cheap, obviously, but it's one of these things where, I let you kind of set up pricing for it. We've gone off of what we've done in the past and what people are historically doing across the country. Obviously, as we're trying to get this kind of up and running, similar to the Denza, right now is going to be the cheapest it'll ever be. But it's one of these things where it's really how many treatment areas. Right. It's not.
Yeah. It's like, how long is it going to take me to do it?
Right. How long is the patient going to be there and how many different areas need to be treated? Somebody that has, 2 little banded areas, it's not going to cost the same as somebody that has 40. And I think that the majority of patients understand that it's the amount of work that kind of goes into it that's commensurate with that. So you can get pricing, come in for a consultation and make sure that that's what you need. It would be foolish to tell you, oh, you need 20, it's this much, because you may end up being a really great candidate for, oh, there's really just 5 lesions here. And then we need to use the money that we would have said is 20 on doing a skin tightening procedure.
And the recovery period, I really want to emphasize how minimal that is.
Right.
I called my patients after I did this on them, and the next day they were a little bit sore. Even a week after, they were back to going to Barry's boot camp and working out and feeling great.
Awesome.
I mean, a little bit of bruising and swelling, but I saw a patient, I saw her a week after I did it today, and she's
looks great.
Yeah.
Couldn't tell.
It was awesome.
That's awesome. Okay. If a tummy tuck and a revision have been done and there's still a good bit of excess skin on the tummy area, what would be a good way to tighten up the skin? It's a good question. So from my standpoint, skin is skin, no matter where you are. You really need to kind of identify if it's going to be a quality, quantity, and in what direction, right? You can always lift tissue up, just like Graper redid a facelift today. You can always lift those tissue planes back up, take out more if you need to, right? Some patients, especially in the massive weight loss patient population, they not only have an excess of skin in this direction, right, up and down, but also kind of side to side. So there was recently a patient, I rarely am a proponent of a abdominal rejuvenation called the fleur-de-lis, right? Which is where the patient has that bikini line incision and also has this straight down the middle of their abdomen incision, right? You look like a trauma page. Looks like you had a laparotomy. And so I typically tell patients, like, look, let's get you right up and down. Let's get that amount set perfect. Let's let you live with your new figure. See if you're happy. If you're not, you can always come back and kind of convert that. So if you've had a tummy tuck, if you've done a revision and you've got loose skin, we have to kind of figure out, have you lost more weight? Is it an increase in quantity issue because now you don't have as much stuffing behind your skin that's keeping it tight? And so now it's looser, or is it a quality issue?
And I always try to, set patient expectations in these cases, because you really want to look good in clothing, right? Because you're going to have a scar.
Yep.
And some patients need a fleur-de-lis.
Yep.
But I agree. It's an unsightly scar to have that big scar down the middle of your abdomen. But if patients want to look better in clothing, then that can be a good option for them.
Yeah, it absolutely can be. And I've even had patients that, obviously I'm not shy with tattoos, but I've had patients that have gotten really beautiful tattoo work over incisions, and some people's scars so beautiful you never even see it, which is amazing, right? So you hope that every patient's one of those people. They not always are, but it's nice to have that as an option. So the short of it is, we need to know what dimension, what direction, what vector you're kind of feeling like you're still loose in, and if you're a quantity or a quality or both issue. But just know that, like, something can be done. I mean, of course, something can be done. I'm the Abelli patient. I really did go back to Barry's boot camp 3 days later. That's kind of funny.
I love her.
That's fantastic.
She's awesome.
Okay. Do you recommend patients who are candidates for Ozempic, Ozempic, go through weight loss treatment before having a surgical intervention for weight loss? So I guess maybe this patient is asking, should they try non-surgical means of weight loss, like through Ozempic or Mounjaro or Wegovy, or should they go get bariatric surgery? So I would say, if you can lose weight without surgery, 100%. There's two types, right? And you're board certified in general surgery too. You did the whole general surgery route like I did, and then did plastics on the end of it. But we all know that there's basically two bariatric surgeries. There's restrictive and there's absorptive.
Yeah.
And both are going to have issues, right? And so if you can lose weight without having to have surgery on your abdomen, absolutely do it. So here's a shout out to somebody who I'm sure is not watching, but has really changed the lives of several of my patients and some of my closest best friends. We used to have a patient that would come in that was 40 pounds overweight. And if somebody's 40 pounds overweight and tells you they want to lose weight, what do you tell them about losing weight and surgery and timing of those things? What's the best way to do that?
Yeah, so I mean, you're always going to have a better result with surgery if you have lost more weight, right?
Right.
So
you want to lose weight prior to us,
right. Depends on the patient, but sometimes their risk of having a complication with surgery is pretty high if they are not at a certain weight.
Right.
So,
and one of the things I used to say, and I was telling this story to somebody today, actually in the break room, is may have been you. Is that I've had patients before that have come in and they've said, I've tried everything, tried everything and I can't just lose weight. And so my smart aleck answer, personality, but trying to break the ice, because I know it's hard to talk about these things. I used to tell patients, have you sent in your application for Naked and Afraid or Survivor? Because you're going to lose weight if you go do that. So you haven't tried everything.
It's hard.
I'll say that, it's not just diet and exercise anymore, right? It's not just about willpower. And I think we're learning that today, as a matter of fact.
Yep.
The FDA approved Wegovy for weight loss, not just for diabetes. And I really think that some of these medications are completely transforming our patient population and getting them to their goals prior to coming to see us, which is just the best recipe possible, right? And so, a couple of months ago, maybe 5 or 6 months ago, my wife and mine's one of our best friends here in town. We love he and his husband, and we went out to dinner, and I was like, what in the heck? You look absolutely phenomenal. And so he told me about a physician here in town who moved here, the last couple of years, and she's been phenomenal. And I started sending patients that otherwise a year ago, before I met her, Dr. Shanna Greminger, these people would have been stuck and they wouldn't have come back, because I would have said, you need to lose 35 pounds before we do your surgery. And they would have never hit that mark, and they would have done one or two things. They never would have gone and gotten the surgery that they wanted, which is life-changing, or they would have gone down the street to somebody else who didn't care.
Yeah.
And is more than happy to take their money and just do it. So sending patients to somebody who is an expert in this field, who's going to check all your labs, who's going to, not just write you a prescription, but actually tailor something to you, has really changed my entire practice, right? Because ultimately we want people, not just from a weight standpoint, it's not just a scale number. We want people as healthy as can be, right? So when people come in and talk about, I think this may have happened to you recently too. If somebody says, I don't smoke cigarettes, I just vape. I mean, what are some of the things that you tell patients before surgery? A lot of times patients come in, we don't have time on the OR schedule to do your surgery next week. You don't want to go to a plastic surgery office that's not busy, right? That's not sought after. So when we've got some time between our consultation and our surgery for patients, what are some of the things that you tell them as far as nutrition and bad habits or good habits? What are some things that you want?
This is one of the things that I am so passionate about and excited about is, I think of surgery as a marathon. You are stressing your body.
Yeah.
You have to be in a good shape. You have to be, you have to be eating a healthy diet. You have to be hydrated. You have to be eating lots of protein. You have to be at a good weight. You cannot use nicotine in any form at all.
And so why is that? Because some people think to themselves that it's literally inhaling cigarette smoke. Oh, I have a patch, a nicotine patch, or I vape nicotine, or I do these types of things. Nicotine affects our body, right?
Yeah, we can talk about all the science and how it shrinks the blood vessels and delays wound healing and all those things, but you and I have both seen in residency what happens when people go,
it's horrible,
out of the country or somewhere else and have surgery and have horrible complications because they're not healthy. They're using nicotine.
That's exactly right. And those patients don't care.
It's a disaster.
That's right. And they don't care. And the patients, the doctors, because they're going to send them back to Charlotte, right? I mean, how many times do we get just that horror story? And there's all sorts of magazine articles, journal articles, all those types of things on patients that fly down somewhere. There's actually just a big bust up, which we've been hearing about for years, on the little like recovery homes afterwards where people go and somebody's taking care of like 20 post-op patients. It's like a factory.
Yeah.
I've had patients that have gone down and consulted with a doctor, and they said, show back up later on this afternoon for your breast surgery. And they show up, and it's not even the doctor they consulted with that does their surgery at 9 o'clock at night.
It's a big business.
It's absolutely insane that people do that. And fortunately, you know, we have a really well-educated patient population most of the time. And so, you know, they're not going to come to us. They know that we're not dirt cheap, and they know our reputation. And so they, you know, they're not really, they're not scraping the bottom of the barrel when they come to us for anything. Right. And so when they start price shopping and looking who's going to do it the cheapest, and I can go to the Dominican Republic and get something that I would have cost me $15,000 in the States, I can get it for $5,000, and I'm going to stay down there and stay in one of these homes and all that kind of stuff. It's an absolute disaster.
Well, I mean, what is an extra $3,000 to $5,000 to come see someone who's well trained and is going to take care of you and see you in the office every week?
Yeah,
and really partner with you through your recovery.
That's exactly right. I think that's
it is well worth.
Yeah, 100%. So the patient that had asked about the excess skin said side to side, right? And if it's a considerable amount of side to side, then I think that's where you convert right to the fleur de lis, and that's easy. And you just have to kind of imagine, what will my tighter abdomen look like with a scar going straight down the center of it? And that's how you have to visualize it. I agree that they will look better in some aspects. I typically don't want to commit to that scar, because I feel like the majority of my patients, when we do that, you know, that's typically reserved for the massive weight loss patient population. And when you get rid of the apron for them and they have a surgery done, and you can spread some of that out if you do a circumferential all the way around, their life, it's life-changing. Yeah. And they're so happy, like you said, that they don't need that.
Right.
And so if you do, if it bothers you, come in, we'll take a look at it, because you can absolutely take care of it. And you may be somebody who has, you know, a non-surgical correction for it, right? All right, so some of the questions for you. Can I have a breast lift after having had radiation therapy? This is for breast cancer patients, right? So the patient went in and had radiation either after a mastectomy or after a lumpectomy, which is called breast conservation therapy. And this side has been radiated. What typically happens to a radiated breast?
Yeah, so you know, I did a lot of breast reconstruction in residency, and I have a passion of taking care of those patients. I love taking care of those patients. Yep. It's a long journey to have breast cancer and go through the recovery of chemotherapy, radiation, reconstruction, all those things. And radiation causes radiation fibrosis, which decreases the ability of that tissue to heal.
Right. So we will see, right, on physical exam, typically 9 times out of 10, we see that the radiated breast starts to retract, right? It gets smaller. Sometimes patients say it looks better than the other breast, it looks more youthful than the other breast, and those types of things. My experience with breast lifts after radiation has been good. And the reason why it's been good is because I offer it to very few people. And I know that sounds kind of, well, it doesn't make sense, but you got to be the right candidate for it. And everybody's, you know, different patients are going to be affected by radiation differently. We all see patients who are just like, I mean, you almost want to weep for them. Their radiation damage is so bad. And then you see some people who it doesn't even look like it's touched them. And you're like, wow, this is amazing. You also have to think about how long the lift is, right? Yeah. So the difference between lifting somebody an inch and lifting
even if the tissue looks
totally
normal,
different. Right.
You just have to be very cautious.
Yeah. And it not only heals differently, it scars in differently too. Yep. Right. So a lot of the times if we want to reduce a breast that's been radiated, right? Like reducing the volume, that breast from the radiation fibrosis wants to continue to get smaller and smaller. So liposuctioning a radiated breast and removing that volume behind it can actually cause that breast to further lift up. It is a reduction in size, and you have to understand that. And then the non-radiated side, you do a lift, you do a reduction, you add implants, you do whatever you need to match the radiated side. So,
And there are other options to add volume to a
Sure.
radiated breast,
Sure.
right?
Yeah.
I mean, a latissimus flap or
Yep.
an abdominal flap.
Yeah, absolutely.
Those can add volume.
Yep.
Where you don't have to do a lift.
Right, and that's where you're bringing your own tissues in, which
Yeah.
is absolutely something that that can be done. But you really, it's a case by case basis, as
Right.
is everything that we do. But all in all, the reduction in the blood vessel and the vasculature and the fibrosis of the tissue, the swelling of the tissue, it doesn't make for a positive scenario in the majority of patients. That being said, I've lifted some patients that didn't have as bad of radiation damage, and they did fantastic. So we tried it. We've learned from people who made mistakes. We've all made mistakes on ourselves. And so now I think we've got a pretty great plan that we can tailor to all individuals. Okay. What type of breast implants do you use on your patients? Not as paperweights.
As far as silicone versus saline or brand,
Sure.
or
Yeah. All right. Go. Yeah. Silicone,
I mean,
saline. What's the difference?
the saline implants, you can have a lot more rippling. The silicone implants, they're 5th generation. You know, they're the most studied implanted device in humans that we've ever looked at.
Thanks, Connie Chung. That's great. Yeah. Appreciate her.
They're really great. They're awesome. They're more natural feeling. They're more natural looking.
And so
I like a silicone implant.
Yeah, well, no doubt. I haven't put a saline implant in anybody in 10 years.
Yeah.
And so I think once you educate patients on the safety of silicone gel implants, they feel so much better, right? The outer shell of either device is silicone.
Right.
So that's what the body's seeing. So if somebody says, I have a silicone allergy, I want saline implants. It's not like the implant's made out of water. I mean, it's water held within a silicone shell. So your body's going to see the same thing. And now what I tell patients is with this 5th generation, the gummy bear, right? What a terrible, somebody in California came up with that term because everyone thinks about the white gummy bear between their seats of their car that their child left from last Halloween. That's hard as a rock. And you still bite on it to see if it's any good, but it's not because it's the white gummy bear and nobody wanted it anyways, right? If it was the red gummy bear, it wouldn't be in there. And so it's really soft. It's the brand new off the Black Forest or Haribo conveyor belt gummy bear, and they feel great. We've got 1 million of them here for you to feel and get accustomed to. But you cut these in half with a samurai sword. It is not like the older implants that oozed out like honey or molasses, right? You just don't have that anymore.
Right.
So these don't rupture. They don't leak. They don't do any of those things. They're completely safe and wonderful. There's 3 implant manufacturers. We certainly use Allergan the most. That's kind of who we use the most here in our office. Mentor makes a beautiful implant as well. Sientra makes a great implant. They're all safe. They're all great. If you have I really want this implant, we use it. We do it all that. So don't think that we have to use a particular type of implant. But we're going on 1 minute. This is groundbreaking because we have now introduced to the public, to our Facebook Live audience, Evan Zug, right? Which is great. So everyone's clapping.
So excited
They're
to be here.
All their drinks are clanging and all that kind of stuff, which is fantastic. We're thrilled to have you. My advice to you is to listen to Dr. Graper way more than you do me. He's been a fantastic mentor and will teach you a lot, not just about being a great surgeon, but being a great person, being a great husband, being a great dad, being a great person, just he's awesome.
This practice is amazing.
Yep.
It's been almost 4 months now, and I feel like family. I'm loving
I love it.
All of our staff, both of y'all.
It's fantastic.
It's been awesome.
Well, it's great to have you. A couple of just kind of pointers for tonight. Don't forget about all the other departments we have, right? They're way more important than the surgeons, and they're way sweeter. They smell much better. Our skincare department is incredible. Candace, Melissa, double Angie's, absolutely amazing. And then our nurse injectors, Linda, Kristen, and Terry are phenomenal. Cool Sculpting with Juliana, laser hair removal with Juliana, Stacy Venator for all of your PRP needs. I mean, all of them. We won't even mention all of them, but we've just got a really great crew here. Administration's phenomenal. Our support staff. We're really, really blessed here. So we're really happy about that. Remember to call for a free complimentary consultation, Fall Beauty 23, but just tell them you watch Facebook and you'll be fine. We'll notify the Botox and revision winners through Facebook and Instagram, likely tomorrow, I would imagine, when we do that. National Botox Day is Wednesday, November 15th, 1 week from today. If you're an Alley member, which you should be, if you get any Botox or filler or do any skincare products from SkinMedica, you need to have an Alley account, because as you start getting points, you get money off. But for Alley members, you can purchase a $50 gift card next Wednesday and you get a $50 one for free. So it's just like $50 in your pocket. If you know you're going to get Botox or filler, it's a no-brainer. $50 goes a long way. And you get double Alley points when you get your Botox this month and have a chance to win 25,000 clams. That's dollars to most people from Alley. But that concludes Fall Facebook Live 2023. Dr. Garrett Harper, Dr. Evan Zhu, Dr. Robert Graper. Thanks for joining us, guys. Bye.